Hi, Miss Points. My name is Liz Hurst. I've really enjoyed your class so far, and here's my midterm project. Here's my ID so that you know that it's me. I've done my project on periodontal disease, something I feel really passionate about, obviously, and I found that while working in private practice that dental assistants and patients really don't know very much about periodontal disease, so I've kind of made it my mission to educate everyone better about that. I found that case acceptance is better. They're more willing to come back for more frequent recare. The patients are, if the assistants are on board and if they're able to back me up as far as education goes and describing treatment options and prevention, everything like that. So here's my project. On my table of specifications here, for the objectives, I have underlined each of the verb words. It helped me to stay on track with the level of knowledge where I wanted to be at. And then in parentheses, I've included the slide number where that can be located in my PowerPoint presentation. So for the first objective, it's student will define gingivitis and periodontitis, and that can be found on pages 11 and 15 in my slide. The corresponding assessment with that is to state the difference between gingivitis and periodontitis. This is very basic, it's just a fact, regurgitating information provided in the presentation. Back up to the top here, my next objective under the comprehend is that the student will explain the periodontal disease process. This begins to be a little bit more involved, or actually have to use a little bit of critical thinking now and explain how the process occurs. It can be found on slides 7 to 8 in my PowerPoint presentation. And then the corresponding assessment with that is that the student will explain the different stages of periodontal disease. And that would be, test question style, where a short essay where they'd actually have to go into a little bit of depth and explain the different stages. For the next dimension here, under the analyze, the student will visually identify signs of gingivitis. And that can be found on pages slides 11 and 12 in my presentation. The corresponding assessment with that is that the student will create a diagram comparing and contrasting the characteristics of healthy and diseased tissue. So they'll actually have to really separate it in their mind and analyze which characteristics would go on each side, pink tissue versus erythematous tissue, and separate those in their mind. So they'll have to think about it a little bit more. So we're going up in the knowledge levels here. Back up to the top, under the evaluate section, the objective is that the student will interpret what is meant by pocket depth, recession, and clinical attachment loss. You can see that we're getting a little bit more deeper knowledge here. Those are some more difficult concepts. And the verb here was interpret. The student will really have to think about more the difference between pocket depth, recession, and attachment loss, and how they might explain that to a patient. The corresponding assessment for that is that I've asked them to develop an analogy to describe the difference between pocket depth and recession. For instance, a turtleneck sweater where the height of the turtleneck can be used to describe the gingiva, and the neck can be the root of the tooth, and how much neck is showing is how much recession there may be. I know I'm not explaining that very well, but an analogy like that so that it might help to teach the patient a little bit better. Under the conceptual domain, the objective under apply is that the student will implement their knowledge of the anatomy of the periodontium through patient education. So here, the knowledge of the anatomy is essential in describing to a patient so that they can actually know the different parts of the tooth, what's happening, be able to describe a crown of a tooth, the gingiva, the sulcus, the root, all of that. The corresponding assessment with that is that the student will illustrate and label the anatomy of a tooth and the surrounding structures. Here they're actually having to combine, factual knowledge with other knowledge, create a bigger picture of the concept rather than just the very basics. And that can be found on slide 3 in my presentation. The next objective is that for under the analyzed dimensions, the student will differentiate between healthy and diseased tissue. So here there are, even more critical thinking skills that they'll have to use to really be able to distinguish the signs and symptoms of gingivitis versus periodontitis or healthy tissue. You can see over the slides where that information can be found. The corresponding assessment is that in a set of radiographs, students will identify bone loss and radiographic calculus. In the slides, I've provided them some examples of what calculus looks like and bone loss, and I've compiled a bunch of different slides so they'll be able to get a little bit more practice analyzing and really using their eyes to find red flags, I suppose, and be able to point those out to patients. And under the evaluate level in the conceptual dimension, the objective is that the student will justify the most appropriate treatment depending on a patient's periodontal diagnosis. You can see we're getting to be pretty involved here. They're having to use many different areas of the lesson here to be able to make some bigger applications. The assessment for that is that the students will be paired up randomly and assigned to a periodontal diagnosis. They will role play and take turns educating each other about treatment and prevention. I find that role play is the best way to practice what you've learned, to become comfortable with the verbiage. I think this will really help them to evaluate what they've learned, to identify areas of weakness, and to make some improvement as far as that goes. And now on to the procedural dimension. Under the know and remember level, the objective is that the student will correctly record numbers on a periodontal chart. This is going back to the basics here. They just need to be able to record the numbers, so it's a pretty simple basic level. The corresponding assessment with that is that, again, it's kind of a role play situation. The instructor or me will conduct a mock periodontal exam, and the students must record the probing depths, bleeding, recession, and furcations, and then we'll go through and grade and see how much they've gotten right, if they got messed up in any areas on any two surfaces, if they weren't quite sure to record bleeding or recession or furcations, we'll make sure that those get recorded so that when they're doing that in private practice, they'll be able to apply that and make sure those numbers are recorded correctly, because that's really important for insurance reasons and everything like that. And back to the objectives here, under the comprehend and understand level, the objective is that the student will interpret which measurements are healthy and which indicate attachment loss. So they actually, instead of just, robot recording the measurement 323, 323, they need to know what those measurements actually mean. That can be found on slide 7 in my presentation. I've explained that, 5 and above with bleeding indicates that there's been some attachment loss or inflammation, and that the patient might be indicated for scaling and root planing. And the students need to be able to understand that that's definitely a red flag there. The corresponding assessment for that is that after completing the peri chart, the students will identify areas of concern and specify why they believe to be an issue. So I want them to be able to explain, here I can see that there's an issue because there was a 5 and there was bleeding. This patient may need scaling and root planing, so that they can help educate the patient. You know, if I was to leave the room or not be available, to explain that, you know, you've had some attachment loss and you have some bleeding and there's some infection. All right, and now under the apply level of the procedural dimension, again, procedural is all about doing, so I really want them to get a lot of hands-on practice during this this section. The objective is that the students will help implement an appropriate home care routine for various periodontal conditions. So if a patient has healthy tissue, what are they going to say to educate that patient? If they have gingivitis, what are they going to say to educate that patient? Or if they have periodontal disease, they need to be able to give them recommendations of what to do at home. Again, role plays. I love that because it really gives them a chance to practice, be hands-on. The assessment is to take turns role-playing, describe and demonstrate to a patient or a classmate the correct method of brushing and flossing. You can see that they have to actually apply here their knowledge because they have to show and do and use their words to describe the correct method of brushing and flossing. Back up to the top here. So under the synthesize and create level of the procedural dimension, the final objective is that the student will be able to teach and train other dental assistants about periodontal disease and treatment. I haven't included a slide number on this one because this is what I would think to be the ultimate objective of the presentation, is that they would be able to educate, you know, other staff members, patients. In order to do this, they really have to have a deep understanding of the facts, the concepts, and the procedures about how this is done. The corresponding assessment is that I would like them to design an in-office program to increase staff knowledge and patient education concerning periodontal disease. So whether this be through a pamphlet, a fun facts board, anything like that, so that we're really doing better about education, and then they're enforcing what they've learned as well. So that was my project for midterm. Thank you again, and looking forward to the rest of the semester.